Hi, my name is Shanice, and I'm the creator of my PA Pharmacology book. I want to start by saying congratulations on your acceptance into the program, and with a few disclaimers. This book is not intended to be an all-inclusive resource of all the things you'll need to know in pharmacology, as the faculty does reserve the right to adjust the material each year. That being said, it is a very good, in-depth resource for you to add or subtract from so that you can spend most of your time in pharmacology memorizing the material, which is what the bulk of pharmacology is. Additionally, I'm not responsible for any errors that are made in the text, although it has been cross-referenced with two textbooks total and our lecture material. Any questions, comments, or concerns can be sent to my PA Pharmacology book at gmail.com, and I'd love to help you with any problems that you encounter. Now let's go into the components of the book, and I'll just go through a few things to help you start your journey. As you get into pharmacology, all of this will make a lot more sense. However, if you do want to start now or start early or just be able to understand the book that I've given you, this video can help you a little bit with that. So both the PDF and Word versions have hyperlinked table of contents, meaning if you want to go to a specific page, all you have to do is click on it and it'll jump right to it. Now these first few charts on here are made for the first exam. In order to understand pharmacology, you have to have quite a bit of background knowledge on how the drugs work. So you may need to understand how they get FDA approved, or different vocabulary that is involved in the drugs overall, as well as what is called pharmacokinetics and pharmacodynamics. Essentially, how the drug is processed in our body and what the drug does to our body as well. So on all of our charts, you'll see something like absorption, distribution, metabolism, and elimination. Now, this is not meant to be an intro to pharmacology, but I just want you to know what that means, as you'll see it on almost every single chart that I've created. Absorption has to do with how the drug gets into the body. Distribution is how the drug moves around the body. Metabolism is how it's processed in the body. And then obviously elimination or excretion are how they're removed from the body. So this first couple charts will be a really good background for you. And once you start into pharmacology class itself, they'll make even more sense. However, you can start now. Let's move into a specific chart for the drug classes so I can walk you through those. So I love this example of the diuretics because it kind of includes all of the things that I want to show you. First off, each drug class, aka like the diuretics, will be all in one color. Now there'll be different shades of that color depending on the information that I'm trying to convey. So many of these drug charts will include an overview, which just says every single drug in this class is going to have these components. I felt that in pharmacology, I was memorizing over and over and over again all these same things. This one causes nausea, vomiting, diarrhea, and this one causes nausea, diarrhea, and vomiting, and I was trying to memorize them all separately. So instead what I've done is at the top of all of these, I've pulled out, these are the similarities for the entire class so that you don't have to waste your time with that sort of thing. So here's the overview. Now, additionally, you'll have different classes within the category of diuretics. So you may have loop diuretics, thiazide diuretics, potassium-sparing diuretics, and they'll be a certain shade of the color. So starting with the columns, you'll have the drug names, and within the drug names, they'll have what's called a prototype drug. That's basically if you can learn this drug in the class, everything else is modeled after it. There may be slight differences that come with it, but by and large, if you can remember one drug in every single class, the prototype drug is the one to learn. From there, you'll see the mechanism of action. And this is basically, how does the drug work? What does it do to make it so that it's effective. Now, most drugs in their own class, such as loop diuretics, will have the same mechanism of action. So that's why all of these cells on the chart are merged, because you only need to learn one mechanism of action and it applies to all of these drugs. Then you can go to the uses. The uses are what patients are we going to use these in, what diseases, and why. Now, a lot of these may have the same, such as loop diuretics can be used for all of these things. However, furosemide and torsemide can be used for uncontrolled hypertension as well. So you can see how if you learn the major drug overview and then the few differences, it's a lot easier. We then move into side effects, and I have all the side effects listed here. A lot of my charts explain why that side effect is worrisome or how that side effect comes to fruition, as in this is what the drug does that causes that side effect, because I felt like for me it was hard to just memorize a full list of random side effects when I could understand why the side effect occurred and then remember it that way. So if that doesn't work for you and you just want to memorize, that's totally fine. Feel free to delete anything in parentheses. These charts are yours to use, and that's why I send you the Word version so that you can edit it. Additionally, you'll see something called BB on all of these charts. They'll have these bolded BBs. That basically is a black box warning. That means that if there's any side effect or concern that you have, that's basically your number one, it's the most dangerous, most damaging, and the FDA has put a very specific warning against it, that's something that you need to remember. So, for example, this can cause hypotension due to profound diuresis. So, on all of your drug categories, make sure you learn the black box warning, if nothing else, because in practice, those are the things that you're going to want to be looking out for. You know, everything causes nausea, vomiting, diarrhea, headache, but not everything causes fatal hyperkalemia or something like that. So make sure that you pay good attention to those. The next category has to do with interactions, precaution, and contraindications. Now, there may be some beneficial interactions. Whenever I say interactions, that is talking about different drugs that if you combine them together, they're going to cause an additional effect, maybe extra side effects, maybe too much of their therapeutic effect. There are a lot listed here that are beneficial interactions. So when you use a loop diuretic, you want to combine it with a potassium-sparing diuretic in order to avoid certain side effects. However, there are some dangerous interactions which are listed here. And that includes, drugs that potentiate the side effects or that reduce the efficiency of the drug that you're giving. So those are the drugs that you want to watch out for. I apologize because some of these on the interactions, it just says many, but I promise you that that's better than having to list out 32 drugs that it interacts with. So things like you'll see it on warfarin or even this drug digoxin, and those will be your best and worst friend because everything interacts with them. So you're not going to learn all the things that interact with it, but at the same time, just know that there are a lot of interactions. So if you see many, it's not because I was lazy. It was just because you're never going to be able to memorize all those. So just be aware. The next thing is precautions. This is, hey, you should be really careful in this patient population, but you can technically still use the drug. That's always going to include, these special populations. You'll see these all over the place. Children, breastfeeding, elderly, those with renal or liver impairment. So you can technically still use the drug. You may just have to adjust the dose. You may just have to be aware that there are additional side effects. So we call those precautions. And then below you'll see contraindications. And this is like, you really, really shouldn't use it in this patient population. Obviously, providers make their own decisions all the time, and it may have the benefits that outweigh the risks. For pregnancy specifically, you will see pregnancy everywhere. Pretty much, I just assume that no drug is safe in pregnancy until I go and look it up. However, there are certain categories of pregnancy, A, B, C, D, and X. And if I don't have it listed there, it's probably somewhere within the A, B, C range where it's like, we have to say don't use in pregnancy just because we don't want to have any lawsuits. But D and X, I will usually indicate because those are like, you don't touch this, you don't smell it, you don't think about it while you're pregnant. So you'll often see pregnancy category X. Now, moving on to the other issues, I apologize that the video is getting a little bit long, but I swear it'll be worth it. The other issues column is usually that PK/PD, the pharmacokinetics, pharmacodynamics that we talked about above. That's absorption, distribution, metabolism, and excretion. And just start getting used to the fact that you're going to have to learn these for every drug. When in doubt, the absorption is in the stomach. The distribution is normal in the blood. The metabolism is by the liver and the excretion is by the kidneys. However, that never stays true. So if I don't put it on there, that's why. It's because it's not important to us in terms of what the metabolism, distribution, or excretion are. However, in a lot of drugs, I will place it. So something like this. The absorption is done orally, and within 30 minutes, you will see effects. For the metabolism, it's hepatic. For the excretion, it's renal. The options for excretion are, you'll see urine, feces, renal, bile, and often you will see U/F, which is urine and feces. So if you see any acronyms in these charts that you don't understand, feel free to email me. I'm going to try and put together a list for all of you in order to make it so that you can understand the acronyms. However, most of us can just figure it out once we've heard a lecture or seen enough of them. That being said, DOC is drug of choice, and you'll see that quite often. Or you'll see FL, which is first line. Additionally, this other issues column will have things like the most frequently prescribed or just other little notes that may be important about that drug. The other thing that you're going to be really shocked at and surprised, but it won't come as a surprise as you get deeper into pharmacology. Let me find a chart with it. You will see these CYP450 inducers, inhibitors, enzymes. You'll see the metabolism say that. Basically, there are these enzymes in your body that do most of the metabolizing of these drugs, and they're contained in the liver, and you'll see about 50% of these drugs are metabolized by some type of that enzyme. So if I put just that the metabolism is CYP450, some of them may have a specific type of CYP, like 3A4, then that means that it's in the liver, and that if there are other drugs that have that metabolism, you're going to see interactions with those drugs. When in doubt, just a point here with Dr. Guillory, when in doubt, pick CYP3A4, unless it's diabetes. Okay, all that being said, I'll walk you through just one more chart so that you can kind of summarize all the stuff we just reviewed. So if there's a total overview, this applies to all of the drugs in the same color chart. If there is an overview within, a specific color, like this class of drugs that activate antithrombin, they apply to only the drugs that are within that section and below. And then the drugs themselves will have all of their additional information that may be different. Try your best to learn the prototype drugs, or just choose one drug in each class that you learn very well, and then learn the differences between the rest. So there you are. If you have any questions, please feel free to let me know. I know that this is a crash course in pharmacology and that a lot of this stuff might not make any sense, but I promise that it'll help you in the future and that it'll be worth this 10-15 minutes of talking about it just to start feeling comfortable. Pharmacology is scary for a lot of people. It's still scary for me. Because I don't know how in the world I can remember all of these drugs, but just take it one drug in a class at a time and then repeat. Thank you guys so much for purchasing the book, and if you need anything else, let me know. Thank you.